My name is Hallie, and I came to Charlotte Plastic Surgery for breast augmentation in 2011. I have been thinking about this my entire life. I've really wanted to get a breast augmentation, I would say since I began cheering.
After nursing both of my children, my breast did change, and I just really wanted to feel more confident.
Breast augmentation is one of the most common procedures performed in plastic surgery.
You know, being a nurse in surgical services, you know, I know a lot of plastic surgeons, so I got a chance to talk to some plastic surgeons, some patients who had had that done as well, just to see their perspective before and after. I just really wanted something natural.
When I talk to my patients about breast surgery, I use three terms. It needs to be subtle, it needs to be elegant, and patients need to have plausible deniability. And we want to perform an operation that just looks beautiful. We like to think our patients have seen our best work and don't know it, because those are the women who just look great.
The first thing I always ask the patient is what they're trying to achieve. Not every person needs the same procedure as every other person.
Augmentation is the most popular procedure done in the United States.
So breast augmentation is essentially just adding volume to the breast. The other option would be perform a lift, and with that procedure we basically reposition the nipple. And with that you can either add an implant for extra volume, or if they have plenty of volume we can just do the lift by itself.
And I felt for me, a breast augmentation would help me feel, you know, like a woman.
Now there are many options when it comes to choosing implants.
Most patients will do well with a smooth, round gel implant. There's a saline option, but we've always had the saline, and unless you're under 22 years old, you don't want saline, because it essentially is a water balloon.
And now with the newest generation of implants, when we make breasts larger, we have the so-called gummy implants, and those give us more control over the nuances of shape.
But they have a firmer gel that maintains a very natural shape.
The Vectra device is a special computer imaging system that allows us to take 6 simultaneous photographs and render a 3-dimensional image on the computer screen. This 3-dimensional image, we can then perform virtual augmentations, so women can try on sizes.
It takes a lot of the guesswork out of the surgery, both for the patient and for the surgeon.
The typical reaction is that women will say to me, if I'd have known this was so easy, I would have done it years ago.
So I was so happy with my results from my breast augmentation that I have now referred 19 women, and every single one of them are completely pleased.